Today is Wear Teal Day. Teal is the color associated with ovarian cancer, and we're using this to raise awareness about some of the most common symptoms of the disease. There's no screening for ovarian cancer. That's one of the biggest problems about it. Also, when it's diagnosed, it's often diagnosed in its late stages. So oftentimes it turns out to be deadly. We're very fortunate today because we have a guest with us to talk a little about this firsthand experience, and also someone that knows a little bit about the medical field as well. Kaye Dolan-Hall is joining us, and you're an ovarian cancer survivor.
Yes.
You're also a nurse. And you work at what, Denver Health?
At Denver Health, yes.
So you were diagnosed at a very young age.
33, yes.
What got you to even go in? What were the symptoms? What happened?
So my primary symptoms were urinary urgency and frequency, and then I also had some back pain and generalized fatigue. But it wasn't until I had really sharp pain in my right lower quadrant that took me into the hospital. It started radiating to my back, and I was worried it could be appendicitis. So I went into the emergency room and got worked up and scans and everything and discovered a mass.
You had to say, no, I'm too young for this.
Yeah, I was pretty shocked, to say the least.
I'm glad you're here because you're young. I think most people think this is an older woman's disease. It's not.
Yeah, correct.
So what was your treatment like? Did they catch it in the early stages? What happened?
Yeah, my ovarian cancer was a pretty rare type of cancer, and it grew pretty quickly, but stayed stage 1A. So surgery was all I had to do. I had a few surgeries to take out the tumor in my ovary, and then recovery.
So lots of times people don't realize the connections between a cancer, gynecological cancer, breast cancer. They're often tied together. You know that too personally.
Yes.
Tell me about that.
So a year after my first surgery for ovarian cancer, I was hanging out at home, did a self-breast exam, and discovered a lump. Didn't think much of it for a little bit, but it was still there for a few weeks. So I went into my doctor, got it checked out, and was diagnosed with breast cancer. Again,
Early stage though, right?
1A as well.
Which is good news. All of this is reasons why we got to be aware.
Yes,
I mean,
absolutely.
These symptoms, like with ovarian cancer, are often kind of not really, they're so subtle.
They're very vague, yeah.
But doing a self-breast exam made a difference too.
It did. It was a pretty small lump, and they were surprised that I was able to find it.
So talk a little bit about genetic testing. I think people need to know how important this is too, because it gives you something to tell you what to be aware of.
Yeah, so I've done genetic testing. Neither of my cancers were genetically associated to each other, but there is a very common connection between breast and ovarian. The BRCA gene is the one that most people are familiar with that ties those two that we need to be aware of and can put you at a higher risk.
I don't want to just talk about the cancer in your world, because here you are, look at you, and I would never know you had cancer. You're also a new mom.
Yes.
So let's give some people some hope. You have a 14-month-old?
14 months, yeah.
14-month-old child after all of this.
Yes.
Oh my goodness. Tell me, what did you think that was even going to happen?
We were not sure. No, that's for sure. We didn't know if it was possible. I do still have one ovary, and we were fortunate enough to be able to get pregnant on our own without having to do any of the IVF or anything like that, and have a beautiful baby girl last year. So we're very fortunate.
Oh my goodness. Congratulations.
Yeah. Thank you.
So we're glad you're here because you shared this story. What do you tell other people? What would you tell women and men in their lives about ovarian cancer?
Well, I think it's definitely important to know the risk factors. It's important to know what the symptoms are of ovarian cancer, which are like the bloating, the urinary urgency and frequency, as well as abdominal pain and feeling full or getting full too quickly when you're eating. They're very vague, like we said before, and it's kind of difficult to pinpoint down, but if you feel off about something in your body, track it and get into your PCP, your primary care provider, as soon as you can, or into your gynecologist.
Well, thank you. Mary Kaye, thank you for being
Thank
Mary
you.
Kaye Dolan-Hall. I'll get
Yes.
it. Okay. And you continue in your wonderful life. Be
Thank
happy,
you.
be healthy, enjoy your life as a mom, a nurse. And everyone, remember, September is Ovarian Cancer Awareness Month. Thank you for
Yes.
coming in.
Thank you for having me.
Thank you.